Hi, everyone. Welcome. Happy New Year. Happy snow day, depending where you're joining from. Great to see everyone or have everyone on the call. We will be able to connect via chat, so I'm just going to put that here. Big welcome to our first webinar of 2026 with the amazing Dr. Julia Moore. So given timing, and we're now shifting our webinars to be 1 hour versus 1 hour and a half. So we'll get started right away so that we can get into some of the good knowledge sharing and discussion with Dr. Julia Moore. All right. So, prior to getting started, we'd like to take a moment to reflect, acknowledge, and give gratitude to the lands in which we have the privilege to work, play, grow, and connect on. So my primary affiliation is McMaster University, which is located in the city we now call Hamilton in the province of Ontario. This is the traditional territories of the Mississauga and Haudenosaunee Nations, protected under the Dish with One Spoon Wampum Agreement, which represents an agreement for sharing and a joint responsibility for care. So we can think about that in terms of our land, resources, but also our society and those social connections and networks. As KBHN and Childbright are national in scope and reach, we give gratitude to the many lands and acknowledge the traditional territories our networks work and operate on. I would also like to introduce myself. My name is Vanessa, and I have the privilege of being the KBHN Implementation Community Facilitator. So I will be part of today's discussion, facilitating that with Dr. Moore and Corey and Celia here today. So quickly, I just want to introduce KBHN's implementation community. This includes both webinar sessions like today and smaller community chats with our Kids Brain Health Network community. The goal of this community of practice is really first to build implementation science and practice, thinking more broadly within our neurodevelopmental disability community, but also specific to Kids Brain Health Network. So our community chats really focus on that smaller KBHN community to share learnings, ask questions, resources, and celebrate successes together. Then with webinar sessions like today, we really like to focus on learning and reflecting on different community identified implementation topics to build and connect with our broader neurodevelopmental disability community in the field of implementation science, with the ultimate goal to advance how we think about and do implementation science in the NDD field. I'll pass it over to you, Corey.
Thanks so much, Vanessa. And thank you, everybody. This is so exciting to have all of these wonderful folks joining us today for this really exciting topic. KBH Plus, you've known us as Kids Brain Health Network for so long, and we're really thrilled to be able to leverage our public funding in the way that we do through the network. But we're also really excited to help through our foundation and those philanthropic dollars and our innovation fund, those private sector dollars to really help mobilize all three of those pillars towards our main goal, which is better outcomes for kids and families. So we're really, really excited as we imagine bigger, imagine different for families and children with neurodevelopmental disabilities, leveraging all three of our incredible organizations that are aligned under one mission, better for kids. And this is one of the great ways that we can convene and do some of this work is by bringing incredible speakers and supporting you all in your own journeys, wherever you are in your organizations, wherever you are in the country or internationally, to advance outcomes for kids. So thank you so much. I'll pass it over to Celia.
Thanks. So I'm Celia. I'm here representing Child Bright Network. So many of you may have heard of this network, but we really focus on, as Corey said as well, thinking about and supporting children and youth and their families with neurodevelopmental disabilities. So we are a wide network that really focuses on patient-oriented research and brain implementation science together to be able to have that bigger impact. And also just wanted to put a small plug, I can put it in the chat, but the Child Bright Network is having their conference coming up at the beginning of February. So there is still a couple spots left. I got an update this morning, but it is filling up fast. So if you'd like to be able to come, there is some amazing speakers that are going to be there, and really a space to build community and really all learn together. And we don't get to do that in person very often. So I hope you're able to join.
Awesome. Thank you, Corey. Thank you, Celia. All right, a few quick housekeeping items. We now have the chat working, which is a big deal. So please put any questions, comments, reflections in the chat throughout today's session. You can also raise your hand and request to unmute. And so then I can do that for you if you would like to come off mute and share your questions and reflections that way. And then before getting started, we just want to acknowledge a few things. First, that inclusivity is one of our core values. We humbly acknowledge that we are on a journey to learn and do better and reflect on how to embody inclusivity in our activities, including webinars like today. So we want to better understand and equitably engage our members and broader community who attend these webinars. So I'm going to launch a quick poll that's first really about understanding a little bit more about identity-based information that you're comfortable sharing with us today. And then second, just a quick knowledge check-in about today's topic. So you should be able to see that, and I'll give a minute for people to respond to that. And I won't share the results just to keep that identity-based information private. But Julia, for your sense on the second question about levels of knowledge, we have a few people indicating knowledgeable, a few people neutral, more people at somewhat knowledgeable, and then a few also at not at all knowledgeable. So I think this is a very important topic to a lot of people here and an opportunity for some good knowledge sharing. Okay, I will end the poll now. All right, and then I will pass it over to you, Julia.
Wonderful. All right, I am going to share slides and I am super, super excited to be here today to talk a little bit about readiness in the real world. I know a whole bunch of you looking in the chat, but there's also a bunch of names that are new, which is kind of exciting because to be honest, I was sort of expecting to know lots and lots of people, but I'm excited to also see some new people. So this is going to have a very different style, I would say, to what I typically do. So I would say this is not classic workshop style, but I would say more like inspired by the fact that I have recently been invited to many podcasts. And so have like casual conversations around implementation topics. And so Vanessa and I, in prep for this, had some good chats about questions that people were asking and things people wanted to know, noting that I know lots of you are in some of our implementation science courses and like learning formally about what is readiness. So I'll touch a little bit about what it is formally, but this is more like the underneath the surface kind of like thoughts, questions, ideas. And Vanessa is going to literally pop in whenever she feels like it. It is unscripted, unplanned, to ask questions that you think, Vanessa, you have, or that you think other people on the call might have as I'm going through things. And I've been doing all these podcasts, and that's kind of how they roll. And it's been quite a fun way to engage in implementation topics rather than like didactic presentation, especially when we're in webinar format. So a bit about me, I am the executive director at the Center for Implementation. We do lots and lots of things. The thing probably most KBHN people would know us as is building online courses in our certificate program, because there's lots of KBHN related people in those. We also build lots of tools and resources that people know about, and sometimes work much more closely and collaboratively with people. But at the end of the day, we were trained as implementation researchers that spend all of our time trying to bridge the gap between implementation research and implementation practice by making what we know about how to implement super practical and accessible for people on the ground. Um, I My name is Julia Moore. I am the executive director here. And a few things about me that I feel like are helpful context in hearing about some of the pieces that I'll talk about. So I am a wife and a mother of two boys. They are 8 and 12. I speak about them often. So I feel like I haven't planned to talk about them, but you never know. I live in rural, central, southern Ontario. And I am a white settler here of French Canadian descent. And I actually started my implementation career kind of more in the children and youth development space. Interestingly, left that space because when I returned to Canada, I'm Canadian, but did my PhD down in the States. When I returned to Canada, the jobs were all more on the healthcare side of implementation and often the older adult population. And so I love KBHN stuff because I get to feel like I return back to some of my roots. So, oh my goodness, we'll see all the slides in super fast motion.
Quick glimpse.
So a few objectives for today is talking about exploring readiness at multiple different levels. And so thinking about the different levels that we can see and think about readiness, like the innovation readiness, the setting, and support systems. And then talking about some of the informal cues and clues that often signal whether something may or may not be ready. People may or may not be ready. And then there were some interesting questions that have come up recently about how to select sites based on readiness that both like consider and advance equity for children and their families with neurodevelopmental disabilities. And so I think that there's a lot of different things that we can unpack in those, and I'm excited for the questions that might come up. Throughout this, you can add questions at any time, as Vanessa said, in the chat, raise your hand, any of those things. We can ask questions at the end, but I'm also kind of more informal, kind of ask them as we go through. So to set the stage, especially now that I know a bunch of people are newer to readiness, one of the ways that people really like to think about readiness is this idea that readiness is about whether individuals and organizations are ready, willing, and able to move forward with implementing the thing that you're talking about implementing. So all of you probably have a program or a practice or something that you're trying, a guideline, a standard that you're trying to get into place, right? And so the question is the setting and are the people ready, willing, and able to actually move forward with implementing this thing? And so this is kind of being the standard way that we talk about readiness. And we even distinguish between whether we kind of like have the structural readiness, like do we have the systems and structures in place, and the psychological readiness, right? Like are people emotionally ready? But one of the really interesting things that is, I think, helpful to disentangle is the fact that readiness actually exists at a lot of different levels. And I'm going to be honest, this is not the way people typically talk about it in the literature. The last slide is very much the literature. This is not necessarily how people are talking about it in the literature, but this is how it's often playing out. And so I'm going to walk through each of these with some examples about thinking about what it looks like to have readiness at multiple levels. How you can have innovation readiness. So like, is the thing that you're trying to implement actually ready to be implemented? You can have setting readiness. So is the setting ready to implement the thing you're talking about? We can have implementation support readiness. And we can have system readiness. So when I start, I think it's really good to think about innovation readiness. Is the thing people are talking about implementing ready to be implemented? And I was trying to think of really concrete examples as I was preparing for today. And one of the ones that really stands out to me is I know a group that has been working on an app for parents. Okay. And the app has been tested in this kind of like smaller subset of people. It is not publicly available on like the App Store yet. It's like accessed in a different way in this testing mode. But now they're saying, okay, we are getting ready to implement this in a broader way. And part of the discussions are about, wait a second, this isn't exactly the same thing because now we need to get it on the App Store to make it publicly available for other people. And so there's a bunch of aspects of the innovation or the thing or the app that require more work to be ready to actually bring forward at that level. And I think we don't often think about the readiness of the thing we're talking about to implement, or I know in KBHN's case, sometimes to scale. So, like, is the thing ready for scaling? Maybe it was ready for implementation in a couple settings, but is it ready for scaling more broadly?
Julia, can I jump in? Two questions that I feel like have been percolating in my brain when thinking about innovation readiness, and maybe this isn't the right part of or component of readiness, but I'm just gonna say it. So when we think about things around, well, sometimes I even think about like researcher readiness. And I don't know if that's like a official term, but sometimes I think about, that the constant balance between adapting and fidelity and researchers needing to also be able to kind of let go of that rigidity is not the right word, but sometimes that, it's been tested in these settings, it's been proven effective based on, X, Y, and Z. So we can't change these components. But like, what if we can? And what if there needs to be some more flexibility about what that looks like? And then I'm also thinking about effectiveness and some of those key outcomes that it's before it can be implemented, we need to ensure that it's actually doing what is intended and benefiting or potentially hopefully benefiting those particular populations. But what level of evidence is required and who should be making those decisions? Um, like sometimes I think we get stuck on, it needs this kind of, a randomized controlled trial or it needs to be tested. And I totally understand that. And that's really important to build the evidence base. But sometimes I get stuck on, how much evidence is needed and who should be making those decisions to determine if it is ready to be implemented.
Oh my gosh. Okay. So I've never heard someone talk about innovator or researcher readiness, but I think that's a thing. And I feel like I'm going to add next time I show, I mean, we did these slides just for KBHN, but I feel like I want to add now a fifth pedal about innovator readiness because I think that you're right. I think that there's a difference. There's a huge mental shift from I am testing this to I am implementing this in a whole bunch of different places. And what does that mean? And so I have not thought about it deeply. I'm flagging it on my list of to do, think about deeply, go for a walk, because I think that that's a big thing.
Love that.
And then, oh yeah, go Celia.
Sorry, I just couldn't help myself. I actually did interviews with researchers about some of this and the impact on whether somebody was open to that and the career trajectory changes that came through around some of that readiness. And there were individuals that actually were researchers and they left their jobs to be able to scale the program because they saw that real big impact, but they knew that they couldn't make it work in a research environment, and others that just had to let it go. And it was quite a pain point for them because they saw that potential, but nobody else took it forward. So the readiness and the capacity and the capability, I think, to be able to think about some of those things came through.
Yeah. And it looks like it's resonating in the chat as well. And I think that ultimately, I think that you're right. Like people have to make a choice. Am I going to be the person who takes this and runs with this to move it forward? Because someone has to steer the ship to make it happen. Or are you going to release it? Who are you releasing it to? What does that look like? And will they be able to move that forward? In terms of level of evidence, okay, this could be like you could spend an hour just on this question. My really quick answer to people is we want to make sure we have some evidence it works. I actually think the thing we really want to know is does it do harm? I think we're not necessarily asking that as much as we potentially could be, because I think the bigger question I want to know before people scale things is this potentially going to harm anyone? And what does that harm look like? Because I think so we can wait for a lot of evidence, but the counter to that is lots of people are scaling things in the system that have no evidence at all. They don't even know how to think about evidence the way we would talk about evidence. And so I think it becomes questions of like, is it working? And really, it's like, is it working better than the alternatives that other people are currently accessing for whatever we're talking about?
Yeah. Okay, I love that. Let me see if there's a question. Okay.
Um, So I think that the next one is about setting readiness. I'm going to talk about this one the least because this is the one I think when we think readiness, we think, is the site or the setting ready to go and implement this thing? I think that we have lots of ways we do this. I'll talk a little bit later about tools we can use and things like that. But this is, I think, is the classic readiness. When we say readiness, we're thinking, is this hospital ready? Is this school ready? Is this community center ready? We're like, are the people, are the parents ready? Kind of is the setting ready to actually go and adopt the thing we want to implement? This is super, super important. But I think this is the easiest one to find information about. So I wanted to focus on things that we like don't normally talk about. One of the ones I think that's really, really interesting that I have never seen in the literature, but I have seen in reality is there implementation support readiness? So I have a non-Canadian example for this one, but I have a colleague who has been working on implementing programs for children with autism across the state of California for many, many years. And they were implementing them in schools and community centers and other kind of settings. And they had started building implementation support infrastructure across the state of California, which is 30 million people. So like population wise, the size of Canada, pretty geographically diverse. And they started having situations where in certain regions, they had implementation support people who were phenomenal. And they could connect with community organizations, they could connect with schools, they could connect with primary care and make things happen because they had an infrastructure that was really strong, essentially strong implementation support readiness in some places. Other parts of the state did not have implementation support readiness for, say, new programs or new sites or settings, or even implementation in general. And I've never seen anyone directly describe it that way, but I think that it's a really interesting idea as we think about scale. And thinking about KBHN and how brilliantly KBHN is building networks of people who understand about implementation, my guess is that people are probably already experiencing things like this across the country, where there are pockets of topics, areas, you know what I mean, where there's probably an existing implementation support infrastructure. There's even hospitals where there are implementation teams and people trained in doing this so that it would be much easier to introduce new things because there's people already on the ground doing that. I've not seen people talk about it formally, but I feel like this is a really interesting thing to think about as you start planning implementation.
I love this. And thinking about the capacity piece, like, and people, please feel free to put in the chat. There is a question, so I'll circle back to that. But if there's any examples of some of the, developmental service rehab organizations that have built this into their infrastructure. So a really great example in Ontario is Children's Treatment Network. Kim Hesketh, who you know, Julia, was really a champion of building this within Children's Treatment Network, which is a children's treatment center, again, here in Ontario. And I think, and I don't know if anyone from Children's Treatment Network is on the call, but I think that has made such a difference when, teams come, they're talking about those particular innovations to implement, exploring that, and then having them on the ground to be able to take that on because they have that implementation science knowledge and have built that support infrastructure in their organization. And then I have other few thoughts, but I want to first acknowledge the question in the chat. So first is, I like the question, but was thinking, is innovator readiness the same as support implementation readiness as part of the implementation team? I mean, the team of members who are also implementing the innovation.
I think that's a great question. I personally see them as distinct because I think that there's a person who's developed a program, a practice, a guideline, a thing who might be in a research institute or a university. They might not be, but they've developed the thing that you're talking about implementing. And then there are other people who are typically responsible for supporting implementation. Sometimes all those people work together in initial stages. But over time, the people who are supporting implementation typically don't necessarily even have direct access to the people who first developed the thing. And so I think I see those as pretty distinct. Early days, I think that they become conflated, but the more you implement in a lot of places, I think the more separate they become. And that most implementation support people, professionals, would not necessarily expect to have direct access to the innovator of the thing. I see there's
And
an IT question as well. That's such a great question. So I think it depends. It could exist at both levels. Sometimes IT is very much a setting readiness thing, right? Like, does this setting have the IT infrastructure to do what you're talking about doing? Sometimes, less often in Canada, but I have definitely seen this in the States. There's people I know down in North Carolina who do all this work, and a huge part of their implementation support is feeding back data infrastructure. And so it's embedded in the implementation support mechanism. And so I would see that in that situation as being there. You could have IT landing more in this bucket too. So I think it can exist in both of those different places.
beautiful. And then I see, Jess Hansen, I was thinking of at CTN, but I also am seeing that Rain Martins has also said that they're moving in that direction for her role at U Calgary, which is awesome. Awesome. Okay. And I wanted to just quickly ask a question,
Yeah.
Julia, kind of thinking about the implementation support readiness piece. So sometimes, and I'm sure many on the call can resonate with this, and I love your point around thinking about this now with all the projects through KBHN that are really working on that scale up. But sometimes you work with organizations and you can tell they're ready. They have the capacity, they have the team, they have the resources. And they're also interested in learning a little bit more about, the process and how they can build that internal capacity related to implementation science. And then there's some that are, more like, it's great, but like, can you just do it for us and tell us what to do?
Yes.
Right. And both are fine, both are good. And I think that varies depending again on the capacity piece. But I'm wondering how you navigate, given the vast organizations and teams you've worked with, when there is or there might not be that implementation support readiness. And that might also be related to the setting level and their implementation team. And it might be a bit of crossover, but maybe they don't have that capacity for implementation support. They don't feel as connected to concepts in implementation science and why that's important. So I see this kind of connected to both, but curious to hear your thoughts and how you work through that with teams.
So I would say a big thing, if people are eager and they want to go and run with it and learn about implementation, obviously I love that and like go with it. When people are less keen to do that, typically more structure works better. So they essentially are saying, I have decision overload in what I'm doing already. I'm not yet convinced that this has huge value for me, but I might move forward with doing it. Just tell me what I need to do. And so we might provide implementation guides that are much more structured, that have, less different options. But we've been really talking more and more with more and more groups about the advantages of building implementation guides, implementation supports that say, hey, look, this is one version of the process. If you want to go and tailor and make adaptations, here, and here are incredible places to do that. If you don't feel like doing that, no problem, just follow the guide. But if you suddenly feel like expanding, and I feel like when you highlight the places that that's a good place to do it, people who are newer can say, I'm just going to roll with like the base model right here. And then they start dipping their toes in an area that they have more experience in, or they feel more comfortable with, or they have more time. And so I think that's kind of a balance that has been really working for some groups. It is more work to build guides that way. But if you have both kinds of sites and you're planning to scale, like why not design it like that from the first place?
Exactly. I love that. That's really helpful. I'm just taking a look at the chat
Yeah, me
quickly,
too.
see if there's, yeah, any additional questions. Awesome. Hello, everyone. Hmm.
I'm going to jump into systems and then I have a quick activity where people can comment before going to some other stuff. I don't think we talk about system readiness enough. And I think for this work, that is super, super important. So, system readiness is like asking things like, for example, I think in Canada, we can think really easily, is the province ready for this thing you're talking about? I remember, I remember where I was sitting when the province of Ontario, where I lived, started changing how they were funding supports for children with autism, right? That was less than 10 years ago. And it really transformed what people had and could not do. Do you know what I mean? I spend a lot of time working with people right now in the province of Alberta, and like there's a lot of change happening in Alberta. It does not mean the system isn't ready for anything, but it means that I think we want to be really aware of what is happening politically within, say, AHS and all of those places before running forward and doing something. But I think there's also places, in fact, for kids' brain health and like thinking of the topics, it seems like places like the province of Manitoba seems much more open to doing a lot of things for a variety of reasons. And there's champions at high levels of the system who feel ready to move things forward. System doesn't only mean the provincial level, it can also mean regionally. And I also think it can mean topic areas. So, mental health is a beautiful example, right? The world has swung towards mental health supports, or Canada has swung towards mental health supports, and thinking about that. And so, if you can align some of your work with existing trends in what people are willing to fund, invest in, prioritize, I think that there can be more system readiness for those things. And sometimes certain topics become much less of interest to people. And so there's kind of less system readiness for some of those things.
Yeah, I love that.
How about I open up this question so people can type in the chat and you can add any questions you had. I would love to know in the chat, what levels have you encountered related to readiness challenges? So like, have you seen more innovation or innovator? We can add our fifth one, setting, implementation support, or system readiness challenges. And I'd love to hear a little bit about that in the chat and open up, Vanessa, if you have any thoughts or questions.
Awesome. Yeah, I'm wondering, Corey, if you have a chance to come off mute, otherwise I can read out your reflection there. But talking about the project teams and functions of the different roles.
Well, this is a reflection that I've just had as I kind of think about holistically all of the different pieces that have to come together. And one of the things that I often think is we focus on those kind of folks that are doing all of the work and trying to do the, especially in our spaces, the connectivity pieces with a new model of care for individuals or building and trying to scale a different product or what have you. And yet, if we don't have the administrative support to scale, or if we don't have the legal team on board, and we all of a sudden have a huge barrier that we need to navigate, and some of these considerations aren't always front of mind on the folks that are trying to understand and kind of gauge readiness. And so yeah, it's just a reflection of, when we think about our team, who's on our team that we don't even know that is on our team? Who are the folks that we're actually engaging with in one way or the other, but might not have been involved in creating a proposal, might not have been involved in thinking through the potential outcomes of something, and yet whose opinions really matter or whose buy-in really matter when we think about scaling. So yeah, there's just something I've been thinking about lately.
Yeah, I mean, I think you're right. Like, we can think about those people at so many different levels, right? Like, that ultimately all need to be playing into what ultimately is going to happen down the line. I see a comment here from Ray about how thinking about savings and counteracting attitudes of austerity at a policy level. I think that is a challenge. Honestly, though, I work across topic areas, right? Like deeply across topic areas, right? Like health, public health, social services. And interestingly, I feel like KBHN is in a position, people who are doing KBHN related work and children with neurodevelopmental disabilities are in a position to connect with people who are in positions of power more easily than a lot of the other topic areas I work with. I think that there are people who are in high level positions of power, policy wise, funding wise, who are connected to people who have a neurodevelopmental disability, who have, you know what I mean? Like family members who do, that sets you up for a different kind of relationship than a lot of other things. And I know it is challenging, but I've seen a lot of topic areas, and this is an easier pitch, I think, than some of the other topic areas I do have to share. And I work with a lot of Americans, so we'll all be grateful that we are doing what we're doing here.
Some really great reflections coming in the chat, and just want to acknowledge the different lived and living experiences of attendees too, and so appreciate what you're bringing to this discussion. There's an interesting one about university settings.
Yeah. I think that university settings are, we talk often about hospitals being like bureaucratic institutions that are hard to change. University settings can be even more challenging. I know people trying to implement in universities, and that's a very, very challenging space, not as the innovator, but as the implementation setting in universities. And I think you're right that there's some interesting different pieces related to readiness there.
And then a lot coming out about the system, which is not surprising. These are really good reflections. Thank you, everyone.
And it's always interesting, I think, how like they're both different and kind of similar. Do you know what I mean? Like there's a similar vein throughout.
Exactly.
All right, so people can continue to add those to the chat, but I want to jump into a couple other thoughts. I think one of the questions that people have is, how do we know that, say, sites are ready? Like, how do we know? So honing in on that setting level, which is the most often, the one we talk about the most frequently, although we can also think about some of these at the system level as well. And so how do we go about understanding, are they ready? So the most common thing that people do is use a formal readiness assessment, right? So people are using, there's, true readiness assessments. You can go and find, there's this tool called Ready, Set, Change that has a bunch of like academic literature readiness assessments. The organizational readiness for change, ORC, is one of the common ones. I think it has 152 questions. So you have to have people who are like ready for an intensive research experience. One of the ones I see people use that people really like is called Readiness Thinking Tool. It can be a one-pager. It can be super simple, high-level questions. People sit down in a meeting, talk through it, document things. And then if you're doing researchy things, a common one that people use is obviously the Consolidated Framework for Implementation Research, or the CFR. It technically is not specific to readiness. It is context at large, but it can be framed and kind of honed in at the readiness level. And I can share that at TCI, we are building a new framework called the Context Compass Framework. The framework actually exists. I think it's even on our website. And I'll share in a moment that what we're building out for that. And it's like an adapted version of the CFR, but has a lot more system level factors, because we know so many people want to think about system level factors, which again is coming up right here. So those are some formal ways. But I think one of the things that comes up often, and I know, Vanessa, you and I talked about this as we were getting ready for this session, is what are some of the like cues and clues that sites aren't ready? So like you can do a formal readiness assessment, but I think there's also all these like informal things that are happening. And so I was out for a walk, which is where I do all of my good thinking, and thinking about like, what are the formal cues and clues? And I was like trying to think of things. And I would say, so I don't have a super clean answer. In fact, my answer feels very intuitive and emotional rather than concrete. But I talk to a lot of different sites. I talk to a lot of different organizations. And there is this often virtually, not always, but often virtually. And there is this level of engagement. There is a level of how people show up, the kinds of questions they ask, literally what their faces look like while they're talking to me, that gives me cues and clues about people's levels of readiness. So I was trying to think of what those might be and how to like dissect what is my emotional experience of like, are people ready? So the first thing I think that happens is there's a question of like responsiveness, engagement, like will people literally answer the emails that you send them? Will they agree to meetings and show up at those meetings and show up at those meetings on time? People not answering or people not agreeing to meet does not mean they aren't ready. It could mean they aren't ready. It could also mean other things are happening. My colleague Sobia has this great example of a program in schools in California where someone wouldn't take a meeting, the principal at a school. Finally, the woman, the implementation support woman says, like, I can help with anything. What can I help you guys do? They say, oh, we're putting on an event. Come help with the event. She says, great. She shows up. The principal says, can you go help shred chicken? So she goes and shreds chicken for tacos for an hour and a half, talks to people while she's shredding chicken. After she's finished, the principal comes to her and says, great, email me tomorrow and we'll set up a time for a meeting. So it wasn't a readiness problem, it was a trust problem. So it doesn't only mean it's readiness, but it could mean readiness. If you have trust and people are prepared to show up, sometimes I'll see people and they're like leaning forward and they're asking questions and they're engaged. And sometimes you see the like lean back, you know what I mean? The like waiting, the like, I'm not really totally envisioning what this looks like for me. And I try really hard to get people to share what's happening and why. It is easy to feel in those moments that it's about me or us or the program or the practice or the thing that you're trying to do. But a lot of times it has to do with what's happening for them. I was on a call last week with a group. We were doing some implementation work. We're building an implementation guide. And all of a sudden there was a very different vibe and dynamic. And I was like, what is happening? And I had a call earlier this week with one of the people on the team who asked me to meet one-on-one. And it turns out they just laid off 10% of their staff. And so everyone is terrified. It has nothing to do with us, but it does affect the readiness of their ability to move forward with things when everyone is scared for their jobs and they don't really know exactly what's happening as they move forward. And so I think that it's sometimes those little cues and clues that really kind of give us a preview into like what's going on, and anything I can do to like build a relationship and get people to share what's really happening, I think starts kind of opening that door. Those are my informal thoughts.
I love that. And you, okay, so you sharing that example around the just like the shredding the chicken and building that relationship. I love that. But it makes me it makes me think that should we actually be considering trust, power, relationships more explicitly in readiness assessments, quote unquote, or conversations, right? Because it kind of relates to the setting level. If you're thinking about the recipients or the implementation team or the people you're going to work with, if they don't know you, if they don't trust you, I think that's an important piece, or there's power dynamics that need to be addressed. Yeah, I don't know, and I don't know if that makes any sense, but I'm wondering if that is something that we need to pay more attention to when assessing readiness or exploring some of that with the different groups we work with.
I mean, I think it's interesting. So my first instinct is I think that those things are essential, truly essential. In fact, I think that those are, you can't do implementation until you have good relationships, right? Like, and that I love the expression people talk about, like implementation moves at the speed of trust. And I actually think we should be throwing trust and power together in there because I think that there's a lot going on with those. Interestingly, I don't know that they necessarily are part of readiness, but they might be, as you say, a prerequisite to get to know what true readiness means. Because I think that there's a big difference between what people will tell you readiness means and what actual readiness is. And if you ask, I have seen it happen multiple times. If you ask leadership, senior leaders, mid-level managers, and frontline people about organizational readiness, it is often not going to tell you the same thing. And so, and not even necessarily in the same direction, right? Like sometimes they have different lenses on things. So I think that readiness can mean so many different things for so many different people, but
Yeah.
that you need to have a trusting enough relationship for people to tell you the truth. Because
Yeah.
to truly know if they're ready, they have to be honest about some not often super pleasant things that are happening within that setting, because that's the stuff that's going to make a setting ready or not ready, not the glossy, we're good at doing all of these things part of what's happening in the workplace.
Yeah. Okay. I love how you framed that, that it's that prerequisite, that kind of essential piece like prior to any of this, the implementation related work. But yeah, isn't often, well, I think the people on the call, our field, we do a good job at paying attention to that
Yes.
and trying to pay attention and really be authentic and meaningful about and intentional about that. But yeah, it's not given as much attention.
Yeah.
In the tools, the, assessments, like before doing this assessment, you should make sure, or like, have you considered these things?
Yeah.
It's interesting.
Yeah.
Sorry, I will let you continue. I just looked at the time. It's
No, I know.
flying.
Well, I don't have a lot of content left. Okay, super good question that I've received for years is, can a site be too ready? And the answer is actually yes, I think. So I have only one example of this. So it doesn't mean it happens often, but I do have one truly concrete example of this, not child related, but the very first TCI project I ever worked on. So TCI is almost 8 years old. So 7 years ago, let's say, I was helping a group implement an initiative in hospitals. I want to say we had about 10 or 12 hospitals, and they had done a readiness assessment. So every single site did their readiness assessment. And I was working with the coach who was coaching all of these different teams. And I remember her bringing me her readiness assessments for her different sites. And she had literally put them in an order of most challenging to easiest so that we could like go through and talk about what to do about them. Because at the time, 7 years ago, there wasn't a lot of guidance on how to address readiness challenges. And I remember getting to the bottom one in the pile, and she's like, "Oh, we don't even need to talk about them. They're amazing. They're so ready. They are off the charts wonderful." And I remember going through and being like, I don't know. Are you sure that this team is ready to do this? Because I think that they're doing really well." And she's like, "Exactly." She's like, "Did you see their scores? They scored higher than I've ever, like, this is incredible." But she was implementing a communication related initiative in hospitals. And this team scored some of the best things I have ever seen across the board. But it also meant that they did not believe that they needed this communication initiative because they really were pretty awesome. And so they had, quote, excellent readiness in the sense that they had great internal communication and leadership support and all of these different things, infrastructure and resources, but they didn't believe that they needed the thing. And sure enough, they did not go on to be very successful because they didn't really need what they were looking for. So were they ready? Yes. Did they need it? No. And did they implement it? No. So I do think a site can be too ready. It doesn't happen often, but do be looking for that. But the flip side of that, I think, is I remember learning about readiness. It was almost 15 years ago. I did what I was told to do, did the readiness assessments. I was working on a project. We had 14 sites. I did readiness assessments for all of them. And we were implementing in all the sites, and some sites were not ready. And I remember going to a conference and asking the readiness researchers, "What do I do?" And they said, "Well, pick the ready sites." And I said, I don't get to pick my sites. Like, that's not how this works. And I have since thought about this so much, how if we only pick the most ready sites, we are potentially only picking the sites that don't need us as much. And we can be deeply perpetuating inequities in the system if we're only picking ready sites. And I actually think this is one of the biggest failures of the research readiness world, because I think it has made people pick ready sites ultimately to the disadvantage of lots of, in this case, like children and families.
Yes.
So,
Um, I have that starred as something to circle to, like how and I think about our research funding systems, how they inadvertently perpetuate these inequities because it's like, okay, you have a grant, you have 2, 3 years, and you have to achieve X, Y, and Z. And there's no wiggle room within that. And I think that's something that Kids Brain Health Network does so well in really acknowledging these realities and that relationships, building capacity, building infrastructure is just as valid as implementing and evaluating in a more, traditional research sense. But when we have these funding opportunities that are limited in timing and you're looking to prove, or answer a certain question, you're going to pick the sites that can do that, right? Versus the sites that maybe are still interested, but yeah, it's going to take them 5 years to achieve that versus 2 years. That's within that restriction. And yeah, I think, we need more funding opportunities like that KBHN has to be able to support and really do that work in a good way. Um,
Yeah.
looking at,
It looks like lots of people that
yeah,
speak to them as well. Well, so I think this leads to this question, which is like, okay, so how
yeah,
do you select sites, right? Like, I think that that's what people, the two readiness questions I get most is how do I select the sites and what do I do with sites that
yeah.
aren't ready? And so those will be my last two things to talk about is, so my tips for selecting sites are one, I think that it is important to assess readiness in all these ways, the formal ways, those informal, can you build a trusting relationship? Can you know what I mean? Like, what can that look like? Do you understand what's happening? Do you have people who are connected? Do they need the thing that you're talking about?
Mhm.
But then I also think I actually had this with a KBHN group when we were doing our project review with them. And there was a group that was asking me questions about selecting sites. And ultimately, with them, it boiled down to this really interesting question that I think might be relevant for lots of people this framing. They had a couple of different options of sites to pick from, some rural, some more urban. And I got to this point where I was like, well, what is the goal of this phase of the work that you're doing? Is it to show that you can do this in different kinds of sites or settings than you're currently doing it in? And the answer was yes. That was their main goal. But sometimes people are looking at like, ooh, can I introduce it to different populations? Can I, like there's a lot of different goals that people have at different stages of the research process, of the implementation process. And I said, well, what are the sites that you currently have done it in? And what sites aren't on that list? And do you have sites now on that list that would address that? And so this person said, well, yeah, we've mostly done it in urban sites or urban or suburban. We don't really have a lot of rural sites, but I think if we're planning to go to scale, that's probably, we need to make sure we know what that looks like. So we want to do that. But I have spoken to other people who said, we want to know what it looks like to implement in sites that are less ready, because I think that that's going to be important for us. And so I think if you step back and say, what is the goal in selecting sites? It can help kind of map and shape out where that's going to go in selecting those sites. I do not believe there's an algorithm. I don't believe there ever will be an algorithm because I think there's too many things going on that you can't do it that way. But I think that there are ways to make explicit or implicit assumptions about why we're picking sites and what we want when we are picking sites, who benefits and who loses in those different combinations. And then my last thought is I want to share that very soon, very, very soon, we will have some answers for what to do if a site is less ready. So Vanessa knows, she has seen the back end. We are in the process of making a new and updated version of the strategies tool. The current version of the strategies tool helps people get from individual barriers to strategies. And the new version can help people get from individual plus contextual barriers and facilitators at that setting site level and at the system level, and get them to strategies that can help address those. And a bunch of those embedded in this are essentially readiness strategies. They're not called separately readiness strategies because we've kind of lumped all of them together because you could encounter those contextual factors a lot of times. But that will be coming out. And so I can show you. This is not like a silly mock-up that is not yet really working. It's very fast. You can't see all of it, but you can go in and start picking things and different strategies related to stuff like, is it a relative priority? How do you do that? How do you enhance engagement? What are the strategies to make that happen? And it has a very expanded list of strategies that include a lot more relational pieces behind the scenes. So hopefully that will help people very, very soon. And finally, I'll say that all of this is being built into our Context at Scale course that is coming out this spring, hopefully, and gets super deep dive into scale, which includes a lot on readiness. And so I'm super excited about that. I'm going to open it to Q&A when I see things coming in the chat right here. And any questions from Vanessa, from Corey?
I won't ask any questions, and I'll let Vanessa kind of help support a Q&A. But just a huge thank you, Julia, for sharing such important work. I definitely can speak on behalf of KBHN, but I think also Childbright. Celia will let me to say that our two networks are so committed to this work, and we're so thankful to have experts like you that are supporting those doing this work along the way. So really thank you, and kudos to all of the folks that joined us today to learn a little bit more about this topic.
Awesome. Well, and all that, I'll say, I feel like, I don't know, I feel like it's such a privilege to be part of all these, like, I feel like I get to like touch all these little KBHN projects. I get to like answer comments and like look at people's assignments and submissions of what they're doing. And it makes me feel like I get to like see and touch this incredible work that is happening across the country and see this infrastructure being built. I mean, I think that ultimately there's going to be better implementation infrastructure for kids with neurodevelopmental disabilities than other topics in the entire country. And I think that that just feels like you're setting the stage for something really, really, really cool. I do see a question here from Linda about hoping to shift other sites rather than having them wait. And so I think, yes, I think that there are absolutely things that we can do to essentially enhance people's readiness to adopt, right? Like, are they getting ready to adopt, not pushing things in, but helping people see, for example, the alignment between what they are prioritizing and the work that might be available for them to do. I think it is easier for people to pull in if they have potentially a suite of options, a suite of programs, and say, what are your challenges related to, kids with neurodevelopmental disabilities? Oh, which of these options would address those challenges? I think that that model allows more of a pull feel than a push feel. I think that KBHN is positioned to kind of help set that up in the system in really, really cool ways. And if you have this infrastructure, you can have more people who are helping that happen. Oh yeah, so there's a good question here about balancing evaluation approaches to readiness assessment with cultural and community needs and their readiness timelines. I mean, I think the reality is there's this intense tension between the timelines we're funded for and the timelines that sites are able to function at. I think that those are amplified in certain situations, sometimes because of cultural or community needs, sometimes because of political things that happen. Like, I think there's a lot of things that make it that suddenly timelines become very challenging. I think that I like to focus on the relationships, the connections with people, and then sticking to the overarching process, but adapting the activities we do within it. So for example, say you have readiness built into the process. Say you have barriers facilitators built into the process, which I hope you do. Maybe you can have a simpler readiness assessment, a 1-hour meeting instead of a full assessment. Maybe you do a brainstorm for barriers instead of a full thing. So we don't drop the activity, we adapt how we're doing it. And I think that that's my way to navigate that. So I
If
know
I
we're at time,
can,
so I'll flip it back to Vanessa or Corey.
well, just because I think I want to talk one infrastructure piece that I think is really aligns with what you just said is as funders, KBHN and Childbright are also in the business of funding the ecosystem infrastructure to help some of that journey. And so by funding the National Youth Advocacy Council, we have an incredible group that you can bring your questions directly to help supercharge some of your proposal writing or some of your understanding of the work you're doing by taking some of that directly to individuals with lived experience that can provide you some advice. And so whilst it does take take a lot of time to build relationships, and it's really critical for both of our networks to have people with lived experience at the center of kind of all we're doing. We as networks have some of those relationships that we can help connect you to, whether it's youth with lived experience, whether it's caregivers and family members that have passed the family engagement and research course, and other pieces of that puzzle. But yeah, we're really focused on building that infrastructure, and so do think about those tools in your tool belt as well. Okay, sorry, pass it now to Vanessa, but thank you all for staying a minute past the time too.
No, that is a brilliant point, Corey, and thank you so much for bringing us back to that and really thinking about the networks we do work with, and how both networks do such a great job at considering these things. And I think it's really helping to shift, I hope, the broader funding landscape and leading by example. So I love that. And thank you so much for everyone for being here today. We really appreciate your reflections. What a beautiful discussion. Thank you so much, Julia, for your expertise, your insights, always being so generous with your knowledge sharing. Lots of exciting things for TCI in 2026. So we're definitely all excited to see that and start to use some of these new tools and resources. And thank you, everyone. I will be circulating a feedback survey if you have the time to share. We'd very much appreciate it, and thinking about different ways we can approach these webinars, different topics, etc. So thank you so much, everyone. Have a great day.
Thanks, everyone.